What is ALS? ALS, amyotrophic lateral sclerosis, also known as Lou Gehrig's disease, is a fatal disease of the nervous system, characterized by a progressive muscle weakness resulting in paralysis. How does ALS progress? When motor neurons gradually degenerate and die, the muscles no longer receive nerve impulse. As a result of the nerve death, the muscles shrink and waste away. A possible cause of ALS: too much glutamate. Scientists aren't sure what causes ALS, but glutamate poisoning is a popular theory. Glutamate is an amino acid that acts as a neurotransmitter, allowing motor neurons to talk to one another. After transmitting a message, glutamate is supposed to be backed up by a cell membrane protein. But researchers at Johns Hopkins University in Baltimore suggest people with ALS don't have enough of that protein. Famous people with the disease: Lou Gehrig. Lou Gehrig, which was a baseball player between 1920s and 30s, holds record for most career Grand Slam home runs with 23. Gehrig focused attention on ALS in a famous speech at Yankee Stadium in 1939. Stephen Hawking, an internationally renowned physicist who is almost completely paralyzed by ALS. Hawking's illness has progressed more slowly than typical cases of ALS. Mary Balastro Pinto, mother of Cake Boss reality TV show star Buddy Balastro, in the season final last month, viewers learned Mary Balastro, a regular in his son's bakery, had been diagnosed with ALS. How does ALS is diagnosed? Some of the tests which can be done in order to detect the ALS are blood test, breathing test, cervical spine CT, electromyography, genetic testing, head CT, nerve conduction study, swallowing study, and spinal tap. How does ALS is treated? Even though it hasn't been discovered a cure for ALS, the Food and Drug Administration approved the first drug treatment for the disease, Riluzole, also known as Rilotec, in 1995. Riluzole is believed to reduce damage to motor neurons by decreasing the release of glutamate. Clinical trials with ALS patients show that Riluzole prolongs survival by several months, mainly in those with difficult swallowing. The drug also extends the time before an individual needs ventilation support. Riluzole does not reverse the damage already done to motor neuron, and persons taking the drug must be monitored for liver damage and other possible side effects. However, the first disease-specific therapy offers hope that the progression of ALS may one day be slowed by new medications or combinations of drugs. Also, physicians can prescribe medications to help reduce fatigue, ease muscle cramps, control spasticity, and reduce excess saliva and phlegm. Drugs also are available to help patients with pain, depression, sleep disturbance, and constipation. Pharmacists can give advice on the proper use of medications and monitor a patient's prescription to avoid risk and drug interaction. The Ice Bucket Challenge was a social phenomenon to help and contribute for the investigation on the ALS. Nowadays, it's been doing investigation on stem cells. In addition to animal models, scientists are also using innovative stem cells models to cell ALS. Scientists have developed ways to take skin or blood cells from individuals with ALS and turn them into stem cells, which are capable of becoming any cell type in the body. In the case of ALS, researchers have been able to convert these stem cells into motor neurons and other cell types that may be involved in the disease. Biomarkers. Biomarkers are biological measures to help to identify the presence or rate progression of a disease in a person, or the effectiveness